Speaker, the Minister of Health has yet to explain why it's okay for her officials to interfere with doctor treatments for Indigenous patients. We have a brutal suicide crisis across this country, and yet her department routinely denies psychiatric prescriptions for new drugs to deal with depression, antipsychotic behavior, and suicide. In fact, they'll force patients to go through 2 failed trial periods with out-of-date drugs before they'll accept the doctor's diagnosis. Wow. They're putting people's lives at risk. So will the minister take responsibility for her office and end the discriminatory and dangerous practice?
Hear, hear.
The Honourable Parliamentary Secretary for Health.
Mr. Speaker, Health Canada is committed to providing medically necessary services to First Nations and Inuit clients through the non-insured health benefits programs. The NIHB program covers over $1 billion in health benefits for First Nations and Inuit every year. Nearly 99% of pharmacy claims and 90% of dental claims were approved.
Member for Thunder Bay, Rainy River.
Mr. Speaker, many Indigenous communities in Canada, particularly those located in rural, remote, and isolated areas, are facing a distressing mental health crisis. These communities too often lack proper access to vital services and support, and the services that do exist are not always culturally appropriate or properly aligned with community needs. Can the Minister of Health please inform this House on the steps the government is taking to help address this tragic and unacceptable state of affairs?
Parliamentary Secretary to the Minister of Health.
Mr. Speaker, I want to thank the honourable member for Thunder Bay Rainy River for his question and for his hard work and dedication. Building on our investment of $8.4 billion in Budget 2016, the Prime Minister announced new funding this week of approximately $69 million in immediate and targeted mental wellness support. That includes 4 crisis response teams, an increase of mental wellness teams from 11 to 43, training to ensure that care services are culturally appropriate, and a 24-hour culturally safe crisis response line. Thank you, Mr. Speaker.
Member for Kamloops, Thompson, Caribou.